The diagnosis is Pityriasis Rosea. This one is really tough to make the final diagnosis like this, honestly. So I don't know how the text will text you this diagnosis. So this one also fall into the spongiolitic dermatitis chapter because when you see low power like this, you're just thinking just like normal skin because you do not see any dramatic changes here. And then one is a tricky thing when you see the slide during the examination. You can see this is a punch. This is not a superficial shave. If you see this is a punch, really highly suspicious of dermatitis because usually the dermatology will do punch to warn you to make diagnosis, the differential diagnosis of dermatitis. If they just give you a shape, it's highly suspicious for a maybe basal cell or maybe squamous cell, kind of this neoplastic lesion. So when you see a punch, you will think, oh, it could be just want to text us about dermatitis, but not always, but just most of the time you can use this trick to just know what diagnosis they want you to make. So and then go back to this slide, kind of more like normal skin. But when we zoom in, one thing should catch our eye. That is this perikeratosis. And then this is not confluence. Confluence, that means all the cornea layer, you will see this perikeratosis. This one just like subtle area. Maybe this one, maybe better. Yes. Just a little bit. Catch your eyes. And then we call this mount perikeratosis. I think just like something on top of a mountain. I don't know why they call this mount perikeratosis. I think when you see this small area of perikeratosis, you can thinking about Pityriasis Rosea of this diagnosis. And then what other feature we can see in this Pityriasis Rosea? Other than this mount perikeratosis, we can see a little bit spongiosis here, especially under this perikeratosis area. See, this is spongedom under this perikeratosis area. And then even under this area, you will see perivascular lymphocytic infiltrate. Then usually we will find extravasated red blood cell. This is all of this red thing is red blood cell. Usually you won't see eosinophil. If you see eosinophil in the normal cell, we will just kind of not thinking about Pityriasis Rosea. So just repeat one more time. Mounted perikeratosis, spongiosis, extravasated red blood cell. With this feature, you can thinking about this Pityriasis Rosea. I think it's really tough because these changes, I mean, really subtle. Sometimes you just do not pay attention. But I think the first thing you need to remember just this mounted perikeratosis, because I think for this whole chapter, I don't even thinking any other diagnosis. You can just have this mount. Oh, maybe have one. When we have that, I will also tell you which one. We should have one. I put one case of that diagnosis. Any question about this one?